All right, so today we have Dr. Gary Gray, the founder and CEO of Gray Institute. Like, can you kind of like share your journey? Like, why did you like start Gray Institute and how has it become now?
Well, over 50 years, it obviously is a pretty long journey. So I'll make it short. I knew I wanted to be um, a strength coach and an athletic trainer and a physical therapist when I was in seventh grade. And I was very fortunate because that's what I ultimately studied for and became. And was always fascinated by how the body was connected, but nobody ever taught me that. I couldn't find that anywhere. I couldn't go somewhere to find out what the foot did to the hip and what the hip did to the shoulder. And so that's really been my pursuit over the last 50 years to find out how things are connected. Back then in the early 70s, 80s, we called it the kinetic chain. As you now know, we call it the chain reaction. It's how the body reacts within itself. And that's pretty much what we've been doing. I still have the privilege of treating patients, which is, I think, I need to if I'm going to go out there and teach. I have to share my mistakes and what I've messed up and what I've done wrong, so I can help the next generation coming up. Hopefully, not to make those same mistakes. So that's been the journey, pretty much.
Nice, nice, nice. So, I guess my first question would be like, nowadays everybody talk about fascia or like, what is it called? Yeah, fascia or whatever. But like, how did you come up with like this 3D concept? And in the online courses, you often talk about chain reaction biomechanics.
Right.
Yeah, how did that come from?
Well, the 3D, strangely, I was not a very good student. Most classmates would have called me dumb. Not to be mean, just that wasn't that sharp. And but I did remember in kinesiology class that they taught me that the body moves in 3D. So I remember seeing the pictures of the planes of motion, and I immediately realized, well, the whole body moves in 3D, not just parts of the body. And so when I got out of school, a lot of what I was taught to do was in the sagittal plane. A lot of muscle function I studied was just in one plane. So if you studied the hamstring, they would just say it works in one plane, in the sagittal plane, at the hip and at the knee. But I, even back in the 70s, thought, well, no, that's not what my kinesiology teacher taught me. She said it goes in three planes. So I started studying how the muscles function in three planes, and then realized every joint moves in three planes. Understand that the fascia moves in three planes. Understand that every nerve functions in three planes. And so even in the mid 70s, everything I did was in three planes. Now, back then, people thought I was crazy. People thought I was nuts. But now it's like, hey, that makes good sense. And people get better if you allow them to move in three planes, and the muscles get better, and the joints move better, and the nerves like it because they get activated. And the fascia says, now finally somebody found a way to release me and let me do what I'm supposed to do. So, and then of course the rest of that, the chain reaction is just the biomechanics of how it's all put together. So that's pretty much, like I said, we've been studying for 50 years and we're still trying to figure it out. We don't have it figured out yet. I don't think we will in the next 30, 40, 50 years. So we're going to keep trying.
Okay. So when do people start accepting this 3D concept?
It took a while, and still taking a while. Um, I have really smart people, smarter than me, come out of school and they have a doctor of physical therapy um, in front of their name, and I'll ask them, how does the hamstring function in three planes of motion? And they will look at me like I'm from outer space. they'll say, "Nah, I'm a doctor. I just got done with 6 years of schooling. I don't think you're right." And I got to take a step back and say, "Well, you're going to have to learn muscle function in all three planes of motion." So if we talk about the Achilles, I'm going to ask you, what does the Achilles do in all three planes of motion? You're going to talk to me about plantar flexion and dorsiflexion, and I'll go, that's a small part of it. And so I wish I could say people appreciate it and understand it and take advantage of it, but because we're still taught in school a non-functional, context-dependent, on the table, single plane approach, it's hard to come out of school and go, "Oh, I got to change my mind." So we're still working on that.
Yeah, and in your, I think it's in the membership, you have a session only for like muscle function.
Right.
And after taking that, that kind of blew my mind that how hamstring works and like how is it a knee extensor
Mhm.
instead of like just flexing the knee
Right.
and how hamstring works as 3D.
Right.
That's that
We
actually blew my mind.
just,
How does this muscle function concept like how did you thought about like yeah, how did it come up?
well, a lot of it I learned from the ground up. I have what's called a foot fetish. What that means is I've always liked the foot for some reason. I can't tell you why, um, but I knew it did a lot more than I thought it did. And I also noticed most of my athletes had feet. When they come in, I go, "That's weird. She has feet." And I'd look at the guy next to me, "Oh my goodness, that guy has feet too." And then I asked myself this question: what do they do? And I go, I have no idea, no clue. And then when I started studying, there were some really good podiatrists that studied the foot and understood that the foot is very, very 3D. And they would look at the way the muscle went through the foot, and then by the way the foot moved, matched the studies of the fact that the muscle then reacted around those joints in three planes of motion. So I thought, well, that's the way it happens all the way up through the body. There's not a place where that goes, that's not true. So, what especially Dr. David Tiberio and I have done is looked at every muscle in the body and said, when you do this, when you throw a ball, when you hit a ball, when you run, when you jump, tell me what the joints are doing. I'll look around the muscles, not only that cross the joint, but above and below the joint. And I'll ask myself, is that muscle being stimulated? And if it is, it's going to be turned on. And so it's functioning. And so all of a sudden we go, wait a minute, that's totally different than what we learned. Wasn't even close. And so we're still doing a lot of trying to understand that. In fact, we're going to be doing a webinar, which brings a smile to my face because I know one of your questions is going to be about Achilles tendon. And we're doing a webinar this next week on Achilles tendon ruptures. And it's fascinating to me that athletes who don't put a lot of pressure on their foot and their leg in a certain movement all of a sudden ruptures the tendon. I'm still scratching my head, but we know it has to do with other muscles. We know it has to do with Achilles. We know it has to do with 3D. We know it has to do with the combination of motions that occur where the Achilles has to say, "Uh-oh, didn't realize that was coming," and kaboom. So it's the blessing I had is it started at the foot, and I apply it all the way up to the nose muscles.
So, um, I think years ago, like during COVID, I did the CAFS online education. It's during COVID, so it's online. And then at that time I thought, I don't get this concept. So I think maybe that's just some sort of like fancy stuff. And then years after, like fast forward to like a few months ago, I was trying to look at like, is there any course that really break down how the first foot works really good? I couldn't find it. And then all of a sudden, my friend messaged me, say like, man, you should try this foot and ankle specialization. So I give it a try. And it was actually really awesome. So, and I was at that time I was thinking if we kind of apply these stuff to like our athlete, is it gonna help us like decrease or maybe like help them like for like ankle sprain or like even Achilles tendon rupture?
Yeah, so that's I love your approach. You obviously have the membership,
Yeah.
and as you know, the membership has all of this in it now. We or you would have had to pay another $500 for every course, and so we have all 1,500 our videos in one place at a pretty cheap price. So I appreciate you bringing that up, and that's just because we want to get that information out there. Because I love what you just said. If we really understand this, can we prevent things from happening? A lot of us have been trained to treat after somebody gets injured, and that's okay because everybody's going to get injured. That's fine, but I would rather be proud of trying to prevent an injury than being proud of rehabbing somebody. And so I love that question. I love your attitude. I love where you're coming from because I think that's really the hidden frontier. We don't spend a lot of time on how do I prevent the Achilles tear? How do I prevent the ankle sprain? How do I prevent the hamstring injury? How to prevent low back pain? How do I prevent ACL tears? We don't spend a lot of time on it. We talk about it, but there's not a place I can go and learn it and say that makes sense.
Yeah, and I think like what fascinates me is like your approach is probably different than most of the people I know. And like I tried it myself. I'm not a really good athlete, so I'm not really gonna tear ACL or like Achilles tendon, but I tried it on myself and it definitely helped me when I sprint and definitely helped me when I play basketball. And I tried it on some of my athlete and they said they feel a lot better.
Yeah. Yeah. It's the interesting thing, and you know this as well, is we're not teaching something new. We're just teaching what we see. That's different. I mean, if we were able to make this stuff up, we'd be pretty smart. But we didn't. We haven't made anything up yet. We're not that bright. All we have done is observed how the body does it. Because my job is to get the body to do it safer and better. That's all my job is. They want to do this. I need to make them better, yet I need to make them safer. And unless I know what the body does, I can't do that. And so
Nice,
we're quite different than a lot of people.
nice, nice. All right, I'm gonna jump into the like the first topic I want to discuss with you right today is about Achilles tendon rupture and the return to play process. I know you mentioned this in the membership, but just want to like, can you give us an overview like your Achilles tendon rupture return to play process start from like after the surgery?
Sure. Well, what's interesting about that is I'll talk to people who've been doing this for years, and they'll have a return to play program. But I always start with this question: in function, in running, in cutting, in pivoting, in jumping, in throwing, I'll name everything the athlete has to do. Can you tell me what the soleus and the gastroc do in three planes of motion? What do you think their answer is?
Their answer, plantar flexion.
Exactly. Very good. So I can't beat them up. Well, I can now because they should know better, because you know better. But that's what we were taught in school. And then I go, okay, well, let me see. Let's take a closer look at it. So I think for your listeners, it would be good, first of all, to kind of have some, you and I have some fun saying, well, let's just start with walking. And rarely, I've never seen anybody just in pure walking tear their Achilles. So we need to understand what it does in walking, because then we can understand what it does when we start heading in other directions faster. So, and this is good because it's fun to talk to you because you already know this. So you pitch in anytime you want, but let's pretend we're the right foot. I'm taking a walk towards you, and as you know, the heel hits the ground. Okay, and when we hit on that outside of that heel, gravity and ground reaction force demand that the heel find its inside condyle. In other words, you can't walk on the outside of your foot every step you take. You can for a couple steps, but when you just don't think about your walking, that heel goes through this frontal plane motion, side to side motion. Some people will call it eversion. Some people will call it plantar flex or pronation. Some people will call it falling in. Those are all good descriptions. All right. But the Achilles hooks onto the heel. So immediately you have to say, well, if that motion occurs, and obviously proprioceptors in that area immediately sense that and they talk to the muscles around that. Well, does the Achilles immediately turn on? And the answer is yes. But why? To slow that down. In other words, they don't know they're slowing things down. They just know they're turning on and they're resisting that motion. They're not bright enough to know I'm eccentric or concentric. They just know if I'm contracting. And so step one is the question I will ask is, so how good of subtalar motion do they have? And do you know how to turn on the Achilles in the frontal plane? And again, they'll look at me like, whoa, I did not know that. Okay, well, that's okay. None of us did. But here's the other interesting thing is that, as you know, when the heel everts, that talus that sits on top of the heel, that bone that has no muscle attachments to it, a weird bone, freaky bone, kind of figure, like, why don't you have anybody holding you on? So the talus, when the heel everts, falls down and in, literally fall. You can feel it on yourself when you let your foot go down. You can see your arch lower and that talus goes down. Well, as you know, the talus has a hat on it, which is the tibia and the fibula. So if I'm the talus and I fall down and in, this is what happens to my lower leg. Well, my lower leg twists in real quick. So we know the soleus is hooked onto the lower leg. The lower leg also makes the femur internally rotate. Well, we know the gastroc is hooked onto the lower femur. So now here's what the Achilles feels. It doesn't just feel this, it feels that. And all of a sudden people go, whoa, what are you saying? It helps decelerate internal rotation. It's a significant force out there. And so far we haven't talked about dorsiflexion and plantar flexion. And then all of a sudden, as the foot is on the ground and as the body comes over the foot, now it slows down dorsiflexion. And while it does that, it gets tension in order to try to begin to invert the heel and externally rotate the tibia, which as you know, we call that econcentric, which that's a real hard one to get your head around. You never heard that in school because we made the word up. And so, but you have to have that word because at that given time, we got the Achilles, because of its contraction, slowing down eversion, slowing down internal rotation, and slowing down dorsiflexion. And at a certain point, it starts to invert and externally rotate. So it's speeding up inversion, speeding up external rotation while eccentrically slowing down dorsiflexion. So then you sit back and go, what the heck is happening there? And then you go, well, the Achilles has this contraction that because of its orientation and because of the body moving forward, now has the ability to concentrically invert the subtalar joint, externally rotate the lower leg and the femur, and at the same time, slow down dorsiflexion at the ankle. And most people go, I've never heard that. And they go, well, I hate to tell you, it's true though, and once you see it, you go, oh gosh, why didn't I figure that out? Because it just makes sense when you look at it. Well, of course it has to do that. And so you have to start with that. Then the other problem is, then you have to tell me what all of its friends do. So now I need to know what the peroneus longus is doing. I need to know what the posterior tib is doing. I need to know what the flexor digitorum longus is doing. I need to know what the other peroneals are doing, because when I rehab a ankle Achilles injury, whether it's a bad tendonitis or it's a rupture, I have to start with not putting a lot of stress on the Achilles, putting more stress on its friends. And therefore, the real question is, who up at the butt is the best friend of the Achilles? And people look at me going, I don't get what you're talking about now. I said, well, when you walk, the Achilles' best friend is the butt. And so if my Achilles is hurt, my butt's going to say, how can I help you? And if we know how to allow the athlete to move, ask them to do something like a lunge and a reach, I can turn on a lot of butt muscles that will ultimately protect my Achilles with very little stress on my Achilles if I know how those two are connected. So even before you start a return to play program, you need to know that. And as you went through the foot and ankle specialization, you saw the progression from I have an acute Achilles tendonitis to a little bit of stress, more stress, and a lot of stress, where obviously now the lot of stress, we now get rid of the friends. We say, but you're not going to be there. Posterior tib, you're not going to be there. Peroneus longus, you're not going to be there. And so that's what we're scratching our head on Achilles ruptures, what causes them. And that's another part of return to play, is to actually understand the mechanism of the injury they had, because that's what we're struggling with. Because we see like Kobe Bryant, when he tore his Achilles, he was just pivoting backwards. Very little weight on that leg. I mean, he just got done dunking off that one leg and putting all kinds of stress on that leg, and nothing happened, you know. And then he's just very, very little pivoting, where if you saw how much stress was on the whole leg, it'd be like 1/10. We don't know that, but we're making that up, but it's a lot less. But then for that lack of stress to tear the Achilles tendon, we sit back and go, whoa, what in the world happened? A friend of mine, Kirk Cousins, he's a quarterback, and he tore his Achilles 2 years ago. You watch film of him and talk to him and say, what were you doing? He goes, I was just taking a step back. I said, did you feel like you had a lot of weight on that leg? He goes, no, it felt like I had more weight on my other leg. And so I said, well, what were you doing? He said, well, I was throwing a ball. I was turning my head. I was trying to get out of the way of a linebacker. And if you asked the Achilles at that time, what the heck's going on here? The Achilles is saying, I don't know, we haven't felt this before, but I have this weird sensation that my friends aren't here to help me. And whatever he does, if it puts abnormal stress on me, I'm going to rupture. And that's what happened. And so the question for Kirk and the question for anybody who tears their Achilles tendon is, what were you doing? What do you think? What do we think caused it? Don't always know that. And based on that, I can now design a return to play program where the strategy is start with very limited normal stress and gradually increase the stress in all three planes of motion with what they have to do. And so most of us have been trained to do the thing, but we haven't been trained to figure it out. And so we'll follow a protocol, or we'll follow what somebody else said. where you're going, no, no, that's not good enough. I want to know what it's doing because once I know what it's doing, then I can help it.
So we kind of talked about this before we start recording, but um after the partial weight bearing, is it like how fast would you implement like the lunge matrix or yeah, how fast would you implement the lunge metric after like 6 weeks you start doing like partial weight bearing? And then like how would you load them besides like walking? And when would you apply plyo? I'm sorry, it's a big question.
No, it's okay. I can answer that. The worst answer you can ever give anybody, but the best answer is always it depends, which no one likes that answer. So, as you noticed in our certification, we had a progression, a logical progression based on the stress on the Achilles. And so, if you pass progression one, you get to go to progression two. If you pass progression two, obviously you get to go to three. You could see that we had probably 100 progressions. Okay. So the answer to your question is how fast do you go from one to 100? Well, some people get there in 2 months. Some people get there in 4 months. It depends upon. So we don't look at it and go, well, is it fully healed yet? We learned years ago with the ACL that the ACL doesn't fully heal for over 2 years, 3 years sometimes. So if we waited on that, no one would get back to play. No one would do anything. You'd be so debilitated you could never rehab. And so we're finding the same thing with a lot of other injuries, including labral tears in the hip and including Achilles ruptures. Is it if you have a pretty good surgery and you have somebody that knows what the silly thing's doing, it can tolerate a little bit of stress really soon, and that stress helps form the scar and form the healing, and it allows the normalized motion of the Achilles. Where if it's in a cast plantar flex, we already know we're going to have problems coming out, and so we progress them based on the biomechanical stress and based on their success. And that's why people have to. So if I said to you, would you start with a anterior lunge with the foot that has the Achilles tear, or would you start with a posterior lunge if you had to choose? And you'd go, well, I think the anterior lunge is safer because there's going to be less stress on the Achilles, and you'd be right. But then I would say, do you want to do an anterior lunge to the right or an anterior lunge to the left? And you look at that and, well, so if I went to the left, the heel is going to go faster. So not today. I don't want that. So I'm going to go to the right. Okay, then I would say, do you want a frontal plane lunge to the right or do you want a frontal plane lunge to the left? And you'd go, I'm going to do a frontal plane to the right because now the heel is going to invert and its ankle's not going to dorsiflex much. And so I would say, well, which one of those lunges do you like right now? You're going to say, well, until they do really good lunging to the right, I'm not going to let them do anything else. Okay, well, how long will that take? I don't know, you know. And then we teach you how to use your hands to add or subtract to the stress, and obviously loads and speed and distance and logical things. So that's what the beauty of applied functional science is you get to think. The bad thing about applied functional science is you got to think. And there's a lot of people out there that say, I just want somebody to tell me what to do. I don't want to have to figure this thing out, which takes away all the fun. Really takes away your value. Because if I could write it on a piece of paper, I got a second grader that could walk them through the protocol. I don't need anybody's brain. But if I have somebody like you that looks and goes, wait a minute, I want to do this logically and strategically and aggressively yet safely, very key phrase, aggressively yet safely, to get this kid back on the court or the field as soon as I can, but as safely as I can, and actually have them perform better after their tear than they did before their tear. You have that has to be your mentality because whatever caused the tear to begin with, we want to get rid of that. And so that's it. It's a challenge. It's you got to be dedicated to do what you're doing. Is that your study? You just can't sit there and go, well, I think I can figure this out. Now you got to understand what goes on, and that's hopefully what we're helping people with. 50 years of studying this, we think we can give you a head start.
Hmm. Just out of curiosity, is there like a lot of pro organization or like college setting reach out to you in terms of like lower limb injury?
What would you think? Go ahead and answer that. So pretend like you're me. What do you think the answer is?
Probably not a lot.
And so the logic would ask the question, well, why not?
Yeah, why not?
So why do you think the answer is why not? So when I say, hey, I think I can help you. I think I can help you prevent Achilles tears and labral tears and ACL tears and low back pain and shoulder stresses. And it's going to save you about $50 million a year in your thing. And why would somebody say, "Nah, we don't want you to show up"? What do you think the word would be?
I don't know.
Could it be pride? Could it be jealousy?
Hmm.
Could it be ignorance? Could it be cockiness? Could it be ego? Don't know. That always has me perplexed because the way I learned was bring in smarter people,
Yeah,
and that's how
definitely.
I learn. I mean, we're going to do the webcast on the Achilles tendon, and I've looked at 40 articles and over 100 videos. And I'm obviously going to bring Dave Tiberio in, and we have our whole gift fellowship helping me. So, if I was cocky enough to say, no, I can figure this out myself, well, I'm not going to get anywhere. I'm not going to learn. So if you're sitting there, the head of a professional, let's say, football team, and you go, we got this covered. All I'll say is, hey, let's just take a look at your injuries last year and your performance, both. And we'll see, if you do very, very little injuries and you won the Super Bowl, then okay, I probably don't want to bother you, bug you. But if you kind of go, well, we lost a few guys we didn't think we were going to lose. And then you have to discern, was the injury something that is preventable? Some of those injuries out there, you can't prevent. Guy runs into a truck, he's going to get hurt. And we can't prevent that unless we train him to run into a truck. So we we do our best. We're there for people, and we're available. And if nothing else, they should be smart as you and just get the membership. Study. A lot of times when you get to a certain part of your career, you go, "Well, I'm already smart as I'm going to get, so I don't need to study." I'm just the opposite. I know how dumb I was. I know how dumb I still am, and I'm thinking, I just want to keep studying. I just need to understand this stuff. So there's a lot of smart people out there. And when you read a lot of the articles and go to a lot of seminars and see a lot of the research, you go, oh, man, I wish I would have known that 50 years ago. So that question's interesting that because I think there's a lot of factors. But when we show up, we're there just to help. So there are a number of teams that are starting to do this, but there's a number of teams that uh, if there one of the big injuries that's occurring that's a hidden injury that sneaks up later is a labral tear of the hip,
Oh
and
yeah.
so I'll ask a lot of the NFL teams. I'll ask even the strength coach: are you responsible to try to limit the number of labral tears these guys have? Well, that's his job. Okay. But then I'll ask them, what causes a labral tear? I don't know. Well, then how can you prevent it? Dead silence. Never thought of that. So until you know what causes an Achilles rupture, it's going to really be hard to uh, prevent it, and it's going to be just as hard to effectively rehab it. So we got our work cut out for us.
Well, just so you know that I told my friends that I'm gonna do a podcast with you. They're like super excited. They keep saying, Eric, please tell him I say hi. So, and those guys are probably one of the smartest in our industry. So you're smart. You're probably smarter than a lot of people.
Uh, I think I wish I know how dumb I am. But I care a lot, and caring makes up for a lot of dumbness. I know a lot of smart people that don't care much, and they're therefore not able to use their smartness to help a lot of people. And I know a lot of people like me who are kind of not that sharp, but we really care. You can tell you care. I can, you put a lot of time and effort into education. I can tell you're going to continue to learn, and um, you have a caring attitude. You have to have that first before you're willing to start really studying and going. And again, when you read stuff from other people, you don't have to agree with it. You're not. You as soon as if you, I'll watch a video and I may or may not understand, or maybe it's my ignorance, or I don't believe what they said. I don't shut it off. I try to ask myself, I wonder why they're thinking that way. So you can get something out of everything, I think.
Nice. I love it. I love it. I love it. So, I'm gonna jump in the next question. I think it's a few months ago that NBA launched this research about like calcaneal navicular joint is stuck for like most of the basketball player at age of 21. And as we know that like if you can't have good subtalar joint motion, if you can't have like good mid-tarsal joint motion, that's gonna affect the whole lower limb or the whole body. So I guess my question is like, uh, since I already did the foot ankle specialist and like your manual approach is different than the traditional one, is that gonna help? Because as we all know that it moves in three planes.
Very good. Well, I'm going to give you another A plus, Eric, because you actually that's a hard question to ask, but you asked it perfectly. And unless you understood the relationship between the subtalar joint and the mid-tarsal joint, and the calcaneus and cuboid, and the talonavicular, which is that's the mid-tarsal joint. Unless you understood that relationship, you could not have answered. You could have not asked that question. So great job. Um, the interesting thing about a lot of NBA players, if you look at their foot structure, you would say they have really flat pronated feet. And I don't think that's a good description because when I describe a foot as pronated, it means it can't pronate more or it can't evert more. In other words, it's dead in the water. So I've seen pronated feet. So you're on your foot, and I ask you to try to roll it in, or I have you look over your shoulder to trick you to roll it in, and it doesn't roll in. Okay, that's not the feet they have. They have these arches that are low that have what we call a low inclination angle of the subtalar joint and of the mid tarsal joint, and they still are able to evert. And so, as you said perfectly, now that they're able to evert, they can unlock that mid tarsal joint, and obviously, eversion causes their butt to load, which is I think the magic of their ability to move as well as they do. I think that's really having a nice foot structure uh, is, like you say, can influence the leg beautifully. But having a foot structure that's nice but's not mobile and ready to go. Um, one of I have a lot of people that I learn from, and one guy is by the name of Todd Wright. He's in the NBA with the Clippers, and I had an opportunity to observe him for a month. So, if you really want to learn, go alongside the shoulders of somebody who's a lot smarter than you, and that's doing it every day, and you'll go, oh wow. But he spends, I think, an average of over 5 minutes per foot pre-practice and pre-game on NBA athletes, which makes a lot of sense because that's the thing that's driving into the ground every time they do something. So, but then what he does with it is he reproduces function. So he does what you say. If I'm going to evert it, I'm going to let the mid-tarsal joint unlock in 3 planes of motion. If I'm going to invert it, I don't want to do that. I just want to load it in inversion. And when I need dorsiflexion in both ways, I have to have it everted and inverted. And then I got to make sure the big toe's working well and the fifth toe's working well. And I got to make sure that I'm having the foot tucked to the hip. So when I'm moving them doing some hip stuff, I'm also doing foot stuff. And so it's brilliant. It's like, you know, like wow. And in his career, since he started that, the number of injuries that he's been dealing with has gone way down. Athletes are still doing what they're doing. They're up and down on that. That's a tough sport. Up and down that floor, as fast as they go and as much as they cut, without much rest. Um, that's a tough sport, and to keep those guys healthy is not easy. So there's a when we wiggle something, that was up. If somebody says, "I want you to use your manual therapy technique," I won't let you wiggle me until you can tell me why you're doing it and what the body really does. You can't just wiggle me for wiggle me sake. So let's say I'm a golfer and I take my club back, and you notice that my left hip, I'm a right-handed golfer, is not rotating as much as it should. And you want to get your hands in there and you want to help it. Well, I'll say before you put your hands in there, you got to tell me what it does. So you got to tell me, well, I'm going to get it to extend, I'm going to get it to abduct, and I'm going to get it to externally rotate with the pelvis moving faster than the femur because that's how it happens in the golf swing. If you tell me that, I'll let you grab my butt. Okay. Same thing with the foot. You start grabbing my foot and you can't tell me how my foot functions when I run up and down the court on an NBA court, or how it happens when I jump, or now when I do a posterior pivot, or now when I have to cut. Unless you can tell me that, I'm not going to let you play with my foot. If you can tell me that, like Todd Wright can tell you, then hey, go at it. You're going to make my foot feel better.
Nice, nice. Shout out to Todd Wright, and I know a lot of like coaches work for him or used to work for him, like all really work on the foot a lot, just
Right.
like Adam Pei. I
Yep.
actually learned from him, like I think it starts from last year. He said that everything starts from the foot. And at that time I was like, man, you're crazy. We got low back pain, we got all the stuff, everything starts from the foot. I'm like, you're crazy. But like just like we mentioned, after doing the membership, like really everything starts from foot. It's like everything starts from function.
Yep. You got it. If people are listening, they go, well, I'm kind of interested in this stuff. Um, I would suggest they get the membership and then start with the foot.
Yeah.
If I was going to recommend something, because
That's
then,
a
then you get to understand the science, and then you can look at 3D maps and calves and muscle function and other specializations in golf, and we have all that stuff in there, just the membership. But I started with the foot. I'm not sure why. I wish I could tell you it's because I was smart. I just was fascinated by the foot. Back in the '70s, I thought, wow, that's pretty cool. You got 5 toes, and I don't know what those do, and you got a heel. I wonder what that heel does, and you got an arch. That's weird. Sometimes the arch looks different. And I go, crap, I better figure this sucker out. So everything starts with the foot.
yep. It's awesome. It's awesome. So I guess another question about like the 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 education or like the topic I want to ask today is like e-concentric. Because like you mentioned, like we used to think muscle function as eccentric, then concentric. It's like different phases. But if you look at sport like sprinting, running, or change of direction, it's actually not they like it's not how it happened. You can't
Right,
do that like in like milliseconds.
right.
So, um, is it like can you dive a little bit deeper into like this econcentric concept?
Well, I think you answered it. I think, I kind of smiling because I haven't heard it explained that well. Because if it was just purely that, we'd be herky jerky. You couldn't smoothly sprint. If all of a sudden all the muscles had to go from eccentric to concentric, we'd kind of look like a herky jerky robot.
Yeah.
And part of developing a robot is how do you develop a robot where you develop a sensor that is on one hand pulling and pushing, and that's what a muscle does. And so that's going to be a hard sensor to design. Now I think they're developing it because some of the robots I'm seeing they're moving a little smoother, but it still ain't going to be as smooth as you would run. And so when we started studying muscle function, the way it's real simple. If the joint's moving and the muscle crosses it, it's impossible for it not to be activated. And so muscles, as we indicated, don't know if they're functioning eccentrically or concentrically. They just know if they're being asked to contract. And then when they're asked to contract, if the joint they cross, or again, it's even more complicated above and below joints. But if the joint that they're crossing is making it longer, we would call that eccentric. If the joint they're crossing now, their contraction allows the joint to actually shorten, the range of motion shortened, now we call that concentric. But let's take an easy one. And it might be easy, might not be easy. But this became really obvious when we looked at the glutes. And the nice thing about the glutes is they're pretty easy to see. Big butt on people. You got a big butt. And if you take just the glute max and just look at it, how it starts around the butt and how it comes all the way around. It's at this angle. And you go, it looks like it's a transverse plane muscle. No, 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 no. It looks like it's a sagittal plane muscle. No, 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 no. It looks like it's a frontal plane muscle. Yes, it's all three, like all muscles. But then all you have to do is say, well, let's just walk and let's see what happens with walking. As soon as my hip flexes, the proprioceptors in my body, not only at the hip, but all around my body, tell the glute to contract. It doesn't know why. It's a dumb structure, but the proprioceptors will say, trust me, you need to contract. If you don't, we're going to fall on our nose. And so they contract. And so the glute feels this flexion of the hip. And so if you said, so glute, what are you doing now? It says, well, while I'm contracting, I'm lengthening because the joints flexing. It's making me longer. And I'd go A plus. Okay. And then in the frontal plane, we would look at the hip going through adduction. When the foot hits the ground, the opposite hip drops. And so the angle of my hip gets this adducted look. And then if I said, so glute, what are you sensing now? Well, as I contract, I feel like I'm getting longer in the frontal plane. And we would say, you are correct. You're getting longer in the sagittal plane because of flexion, and you are getting longer in the frontal plane because of adduction. Okay? Then we say, what is happening in the transverse plane? Well, you're going to go back to everything starts at the foot and say, wait a minute. Gravity is going to cause hip flexion. Gravity is going to cause hip adduction. But it's the subtalar joint that everts, that turns the tibia, that turns the femur, that causes rotation of the hip. So the glute's going to say, this is kind of funny, but my foot's making me feel lengthening in the transverse plane into internal rotation. And we'd say to the glute, no, that's not funny. That's exactly how it happens. And the glute would say, okay. And then, so we'd say, so right now, glute, what do you feel? I feel lengthening in all three planes of motion. I'm eccentric in all three planes of motion. Very good. What's your job? To let Gary walk without falling on his nose. Good. So are you ever going to have to go from flexion to extension? Yes. One of my main jobs. Okay. Well, if you're strong enough and you can overcome that lengthening, that eccentric lengthening, and now allow the create enough contraction where now you can get the hip to now extend, will you do that? And they'll say, sure, that's my job. I'd like to do that. So at that time, when the hip is now going through extension, are you responsible for that? Partly. And therefore, how are you functioning? Well, obviously, concentrically. I'd say, very good. But in the frontal plane, same thing. It's going to feel going center of gravity from my right side to my left side, from adduction now to abduction. And you're going to control that pelvis and control that hip. And now you're going to say, I absorbed adduction and I'm going to throw you into abduction. And I'm going to say, what do you mean? I went eccentric and then I went concentric in the frontal plane. I go, wow, glute, you're a pretty smart dude. And he goes, well, I'm not smart. I'm just reacting to the stimulus that's given to my body. And then I said, but let's go back to the transverse plane. What's happening there? It goes, well, that's kind of weird because my other foot is going in front of me. And therefore, my pelvis is going faster than my femur. And therefore, relatively speaking, I'm going through a lot of internal rotation. And then we say, well, wasn't that what you went through at the beginning when you were eccentric? He goes, yeah, yeah. So you're going through more internal rotation. Yes. So what do you feel? I feel eccentric lengthening. We'll go, oh crap. Wait a minute, time out. I gotta back up because I must got confused. Because at this given point of time when your hip is extending and your hip is adducting to propel you to the other side, are you telling me you're still going through internal rotation eccentrically? Yes. Well, what do we call that? And the glute would say, I'd call it econcentric because I'm doing both at the same time, at the same joint. Now, some muscles will econcentric at different joints at the same time. And some will do at different planes at different joints in the same plane. That's why the muscle thing's kind of fun, but confusing. You know, when you go through that, you go, oh man, that guy's crazy. You know, that guy's nuts. But it's the beauty of that. Now, think about how do I get a stronger extension and how do I get a stronger adduction out of the butt muscle? And the answer is lengthen it. How do I lengthen it? It lengthens when it goes through internal rotation. So is it possible that if I don't have good internal rotation during gait, it will weaken the ability of the glute to extend the hip and adduct the hip and to get me to really load and get ready for the next step? And it's not only possible, that's the new thing we found, that if you know how muscle does econcentric and the eccentric component you don't have good motion in, the other two concentric motions ain't going to be good. And you're going to be yelling at them to extend their hip, adduct their hip, adduct their hip. And all the meanwhile, the glutes is going to go, all you got to do is wind me up in the transverse plane and I'll do that for you. So if I was listening to this right now, I'd go, oh, that's complicated. Because it's complicated. But that's why most people haven't studied it because it's not simple. You know, I'd rather have somebody say, yeah, the glute extends the hip. Let's get out of here. Easier. It doesn't do it that easy. But that's why we can move smoothly, like you said. Because all of that transition happens smoothly and sequentially and at different rates. And it allows the smoothness of the body to be able to be a thing of marvel.
Nice, nice. That's awesome. All right, last question before I let you go. Okay.
Sure.
So in the membership, besides foot and ankle, They're actually a part which is, I think the topic is classic content.
Yes,
And in that classic content, like I think it's I don't know when you filmed that, but there's ACL prevention. If I remember it correct, there's ACL prevention, and
yeah,
there's also a adductor.
right.
And shout out to Adam Pelly. Adam Pelly and Scott Eppley. They did amazing job at doing this research about like ACL rupture mechanism. And I think in that you also kind of in that classic content adductor also kind of link ACL to like adductor, right? So can you talk a little bit about it and how would you train the adductors since it's not like stabilizing the hip or doing adducting?
Very good. You're getting A plus 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 now because or not, the classic content still is valid. We recorded that about 30 years ago, and we understand things better, but luckily not different. So all of that information, in other words, that's a nice place to start because it's a little slower, it's a little more logical, and it doesn't jar you like econcentric of the glute would, or how the foot really talks to the shoulder. That's so. Just like anything else, you have to ask yourself: if somebody tears their ACL, what caused it? And you can't answer that until you tell me what the ACL does. And you also have to look at a lot of film now when somebody tears their ACL and say, what do you see here? What do you see at the knee? What do you see at the hip? What do you see at the foot? What do you see at the other leg? What do you see at the trunk? What do you, we see ACLs sometimes caused by what the neck did. And so once you understand that, you go, well, the knee is supposed to go in order to load the hip and the foot. The foot will demand it. If you can try to keep the knee over the foot, first of all, you can't. That's a ignorant rule we came up with years ago. We thought we were keeping people safer, but in reality, we were making them worse. Our heart was in the right spot. Our head wasn't thinking well. And so when you look at the muscles, the underrated muscles that can help us, one group are the hip adductors. And when you look at those suckers, they're big and they're powerful and they are honkers. Except just like with every other muscle, we thought they adduct the hip because that's what they were called. So a lot of people to strengthen it will lay you on your side, put your foot up on a chair, and have you make your legs come together like a seal. And when you just look at that, you go, that doesn't look right. I've never seen anybody do that before. That's what sport is that? I don't know what that is. And if you've ever felt it, it really feels bad. It's kind of like that hurts. I mean, that puts an abnormal stress on my adductors I've never felt before. And so we have to ask ourselves, what do the adductors do? And going through the whole biomechanics without going deep right now, they are a sagittal plane muscle. They're a transverse plane muscle, one of the most powerful transverse plane muscles on both sides of the pelvis. And they're also a frontal plane muscle. However, here's the weird thing. If if the person listening to this stands up and just lets their butt slide to the right. So if I stood up and I just kind of let my butt go to the right, or did a lateral lunge with my right foot and went way out there, I will feel my left adductor eccentrically lengthen. And I'm going to go, well, that's weird. I'm moving my right hip, but my left adductor is slowing it down. And I'd say, correct. What is it doing? Well, it's decelerating adduction and it's accelerating abduction. And I'm thinking, well, that's just the opposite of what they told me it was going to do. And now the other leg is doing it. And we'd say yes. But just look at this beautiful pelvis and these legs that come down and these honker of muscles in the middle here. And just see the body rotate through space as it does when it walks and get an idea of what those adductors, if they have good mobility in all three planes, they can do, and they can grab that pelvis and bring it back and grab that leg and bring it back. Well, that's what has to happen with preventing an ACL tear. Those adductors have to be mobile in all three planes and strengthened in all three planes. So when that femur wants to dive in and that femur wants to internally rotate to turn on the butt, which is good, it's going to then say, I need help getting out of that. Because if I keep going that way, I'm going to tear my ACL. And so if the adductors aren't part of the party, you're going to tear your ACL. So as you know, you could talk to some really smart people in ACL quote unquote prevention and tell us and say, tell me how you would train the adductors, and they won't know. They won't even consider the adductors. That's not even in any of the research. But they're very, as you just stated, and you know very well, they're very important. So if I was listening to this, I'd go, crap, that makes a lot of sense to me. I'm going to go to the membership and I'm just going to look up adductors and I'm going to see what those suckers do. And then you're going to go, I'll be dog. They control the knee and the foot and the trunk. And well, by golly, and they're underrated. They're powerful. But usually when you have power, you don't do much. And so you just splint and you think, well, you must be strong and stable. No, a muscle that can't be mobile is not stable. A muscle that doesn't have the bright three-dimensional pliability is the worst muscle in the world. So it's pretty interesting that you correlated those two because it's a huge correlation that very, very, very few people know about.
Thank you. Thank you. I really love this. I really love this. Thank you for answering all my questions, and it's really awesome. I take a lot of notes.
It's my honor that you reached out to me. And what we'll do, I tell you what, we'll wait a few months and we'll do it again.
Okay, okay.
So in a few months, be kind again and reach out to me, and we'll plan a morning like this because I've enjoyed. What I've really enjoyed is you've done your homework. You know this as good as I do, and you're asking questions that you kind of already know the answer to, which is pretty cool. Because sometimes when I get interviewed, people I can tell people are asking a question they have no clue what I'm talking about, and that's kind of hard. Um, and so they either have to believe me or not. You know, where you are a believer of the truth, and if you already believe the truth, it's easy to talk to you. So you made my job and my opportunity and my privilege to talk to your members a real joy this morning. So thank you.
Appreciate you, Dr. Gray. So, last thing before I let you go. Like we mentioned, there's like 3D maps, there's like calves, there's like foot ankle specialization. There's even like soft tissue transformation, if remember it correct. Sorry, functional soft tissue transformation. So for those who are interested in what we are talking about today, they're interested in any course or like membership. And as I know, you also have gift mentorship.
Right.
Where can they find those information and where can they find the webinar about Achilles tendon you mentioned?
Beautiful. You simply go to grayinstitute.com. The membership is something we just did because I'm old now and I want the word out. And so instead of making you pay $20,000, I'd rather you pay $700 for everything. And people think, well, you're nuts. And I'll go, yeah, I'm nuts. But I'd like that as much information out before I die. You know, that's just might sound morbid, might sound perverted, it might sound strange, but the membership, I would. It's going to be hard for me to believe within 2 years if anybody moving in the movement profession isn't part of the membership. I would really ask them a serious question. Why don't you want to learn how the body functions? That's all it is. And so that's at grandstudent.com. Just type on membership. And then obviously we have the mentorship gift program, which you have to be a part of next year. So now that I know how smart you are, you have to be. So you need to look at that and see what you're going to be doing next year. That'd be my honor to have you part of gift. And then if people want to buy the courses individually, they can. But why would you spend $600 for one course when you're going to buy $20,000 worth of courses for $700? I would really, I challenge you, say, I don't think that's a good use of your money. You could probably for $100 more, it's kind of like getting a car that barely moves and spending $10 more, and now you have a race car. Yeah, just spend the $10 more, and get it. So I appreciate you asking that. The webinar also is you can sign up. It's going to be free. People, if boy, they could hear you and I talk before the webinar, that'd be awesome. If there's some way you could get this out before that, because it's going to be next week. But then what we do is we put the webinar on the membership, and obviously doesn't cost anymore. So they can sign up for the free webinar just by going to grayinstitute.com.
Nice, nice, nice.
All right, buddy. Great job, Eric.
Thank you.